In this presentation, an intraarticular fracture of the femur, a 3-3-C2 fracture, will be treated with the variable angle LCP curved condylar plate system 4.5/5.0. The objectives are to identify the clinical indications, to introduce the principles of the variable angle LCP curved condylar plate system 4.5/5.0, to show the patient position and approach, and perform the reduction and fixation of the fracture. The variable angle LCP curved condylar plate system is indicated for multifragmentary distal femur fractures, including supracondylar fractures, intraarticular and extraarticular condylar fractures, periprosthetic fractures, fractures in normal or osteopenic bone, and non-unions and malunions. This 23-year-old female patient was involved in a high-speed road traffic collision, sustaining multiple injuries, including a complex intraarticular fracture of the left distal femur. The CT scans confirm multiple displaced fragments at the femoral articular surface, including a coronal plane Hoffer fracture of the lateral femoral condyle. Following AO fixation principles for this 3-3-C3 fracture, the articular block was anatomically reconstructed and stabilized using multiple interfragmentary screws. After restoring length, alignment, and rotation, the multifragmentary metaphyseal region was bridged using the variable angle LCP curved condylar plate. Variable angle locking screws were inserted in the distal portion of the plate in order to gain purchase in all articular bone fragments. By directing variable angle screw placement between the interfragmentary articular screws, all distal screw options in the plate were successfully utilized, providing maximum possible fixation in the articular block. The plate shaft is pre-contoured to mimic the anterior bow of the femur. The plate head is pre-contoured to match the distal femur. The plate has variable angle locking holes and variable angle combi holes. 4 columns of threads in the variable angle locking hole provide 4 points of threaded locking between the variable angle LCP plate and the variable angle locking screw, forming a fixed angle construct at the desired screw angle. The central hole in the head of the plate is a fixed angle locking hole and accepts variable angle locking screws. The 2 K-wire holes aid in temporary fixation of the plate to the distal femur. The head of the 5.0 mm variable angle locking screw is rounded to facilitate various angles within all variable angle locking holes. Screws can be angled anywhere within a 30-degree cone around the central axis of the plate hole. The variable angle is of value in articular fractures and in periprosthetic situations. To help in the reduction of distal femur fractures, the knee should be placed in flexion in order to relieve the tension of the gastrocnemius muscle. The positioning must allow radiological examination in both planes. This can be achieved either by raising the other leg so that the injured leg can be approached from the side, or, if possible, by lowering the other leg from the hip. The femoral distractor is an excellent aid for indirect reduction. The shank screws are placed in the anterior tibia and anterior femur. A shank screw can be inserted into the distal femur to help manipulate this fragment. The window in the bone model represents one view available from an image intensifier. In the presence of a complex intraarticular fracture, a 3-3-C2 or C3 fracture, a lateral parapatellar approach is made. An arthrotomy is performed to expose the joint for reduction. The incision is extended for adequate exposure of the joint for anatomical reduction and fixation. The soft tissue is held open with the spreader. The large pointed reduction forceps are used to reduce the joint block. The reduction must be checked under image intensification. The reduction is first secured with two centrally placed K-wires. It is important to use two K-wires to ensure rotational stability. The reduction forceps are now removed. To compress the joint block, 2 or 3 screws are placed from lateral to medial along the periphery of the articular surface. This leaves a free zone of bone for the placement of the plate. These screws may be fully threaded 3.5 mm lag screws, 6.5 mm partially threaded lag screws, or 4.0, 4.5 mm cannulated partially threaded lag screws. For this exercise, two 6.5 mm cancellous bone screws with a 32 mm long thread are used. The screw hole is pre-drilled with the 3.2 mm drill bit, parallel to the level of the ventral condyle. The depth gauge is used to measure the screw length. The appropriate length 6.5 mm cancellous bone screw is inserted. For older patients with bad quality bone, a washer can be added. A second 6.5 mm cancellous bone screw is inserted in the same manner to ensure rotational stability. The two K-wires are now removed. In certain fracture configurations, forceps and K-wires can be used to reduce the condylar block to the shaft. It is important to have a good reduction before the plate is applied. Use clinical examination and radiographic imaging to confirm the reduction. The instruments needed to attach the insertion handle to the plate are the insertion handle for aiming arm, the locking bolt for aiming arm instruments, the locking nut for aiming arm instruments, the handle for percutaneous drill guides, and the 11 mm combination wrench. Screw the handle into the locking bolt. Thread the locking nut onto the locking bolt. Position the insertion handle so that the spherical pins on the underside align with the dimples around the first combi hole. Insert the locking bolt with nut through the hole of the insertion handle. Thread the tip into the threaded portion of the combi hole by hand until it is finger tight. Remove the handle. Tighten the locking bolt with the combination wrench. It is important to place the plate on a flat surface when positioning the insertion handle and locking bolt to ensure the locking bolt is perpendicular to the plate and not cross-threaded into the combi hole. The instruments needed to attach the aiming arm to the insertion handle are the aiming arm, the guide sleeve, the wire guide, and the 11 mm combination wrench. Attach the appropriate aiming arm to the insertion handle. Use the combination wrench to secure the connection nut to the insertion handle. Insert a guide sleeve into the hole in the aiming arm that corresponds with the most proximal combi hole in the plate. Insert the wire guide through the guide sleeve and thread it into the plate. Using the combination wrench, tighten the nut on the locking bolt to compress the insertion handle to the plate. This step ensures that the holes of the aiming arm are correctly aligned with the plate holes, and that this position is secured before inserting the plate. Remove the wire guide and guide sleeve to prepare for plate insertion. Before insertion of the plate, blunt scissors are used to create a tunnel beneath the vastus lateralis. The plate can now be slid through the parapatellar approach, under the vastus lateralis muscle and along the femur. There must be no anterior gap between the plate and the bone to avoid irritation of the tractus iliotibialis. This gap is created if the surgeon tries to position the plate in an orthograde fashion and does not orient the plate to the bone surface. Mark the position of the most proximal plate hole on the model. Pull back the plate. Make an incision over the planned proximal plate hole. Insert a finger into the incision and palpate down to the bone. Slide the plate proximally. Use the finger to guide the plate to the correct position on the bone. The position must be checked under image intensification. The plate is temporarily fixed distally using 2 K-wires through the K-wire holes in the plate head. At this stage, the fracture must be fully reduced, as the correct plate position is dependent on the correct length, alignment, and rotation of the fracture having already been achieved. The instruments needed to secure the aiming arm to the plate are the guide sleeve, the trocar with handle, the wire guide, the handle, and the 2.5 mm guide wire with drill tip. Insert the trocar with handle into the guide sleeve. Insert the assembly through the incision and down to the plate. Align the self-retaining features until the guide sleeve snaps completely into the aiming arm. Remove the trocar. Ensure the arrow on the guide sleeve is in the direction of the locking screw arrow on the aiming arm. Insert the wire guide with the handle through the guide sleeve and thread it into the plate hole. Remove the handle. Insert a 2.5 mm guide wire through the wire guide and into the bone using a power tool. The instruments needed to insert the pull reduction device are the scalpel handle with a scalpel, the guide sleeve, the trocar with handle, the 4.3 mm drill guide, the handle, the pull reduction device, and the 11 mm combination wrench. Pass the scalpel through the corresponding hole in the aiming arm and make a stab incision. If the direction of the blade must be changed, it should be backed out, rotated 180 degrees, and reinserted through the aiming arm. The trocar and guide sleeve are slid through the aiming arm and the incision down to the plate. Remove the trocar. Ensure the arrow on the guide sleeve is in the direction of the locking screw arrow on the aiming arm. Attach the handle to the drill guide. Insert it through the guide sleeve and thread it into the plate hole. Remove the handle. Insert the pull reduction device through the drill guide. Ensure the nut sits high enough not to interfere with the insertion. Stop insertion before the tip reaches the far cortex. Remove the power tool and begin tightening the nut toward the drill guide, first by hand and then with the 11 mm combination wrench. Monitor the progress of the reduction of the bone to the plate under image intensification, and check the final reduction again. The instruments needed to insert a variable angle locking screw in the central plate head hole are the 4.3 mm drill guide, the calibrated 4.3 mm drill bit, the T25 star drive screwdriver shaft, and the T-handle with torque limiting function 6 Nm. To insert a locking screw with a power tool, depending on the content of the instrument set, the T25 star drive screwdriver shaft with a hexagonal coupling is used with the chuck and key, or the T25 star drive screwdriver shaft for the quick coupling is used. Thread the 4.3 mm drill guide into the fixed angle plate hole in the center of the plate head. Insert the drill bit through the drill guide and advance until it reaches the medial wall of the femoral condyle. Read the measurement from the calibrated drill bit. Remove the drill bit and drill guide. The measurement can be checked with the depth gauge. Insert the appropriate length 5.0 mm variable angle locking screw using the power tool and the T25 star drive screwdriver shaft. Confirm that the screw is parallel to the knee joint and the length is correct under image intensification prior to final tightening by hand with the T-handle with torque limiting function 6 Nm. If the screw is not parallel, then a malreduction will persist. In this scenario, the surgeon must return to the fracture reduction and repeat the process. Remove the K-wires. The instruments needed to insert a variable angle locking screw in the plate head are the 4.3 mm variable angle double drill sleeve, the 4.3 mm calibrated drill bit, the depth gauge, the T25 star drive screwdriver shaft, and the T-handle with torque limiting function 6 Nm. Ensure the cone-shaped end of the double drill sleeve keys into the cloverleaf hole. The drill bit can be angled in the cone to the desired direction. Remove the drill sleeve and use the depth gauge to measure the screw length needed. Insert the appropriate length 5.0 mm variable angle locking screw using the power tool and the T25 star drive screwdriver shaft. Final tightening must be done by hand using the T25 star drive screwdriver shaft and the T-handle with torque limiting function 6 Nm. The straight end of the variable angle double drill sleeve allows fixed angle drilling to ensure that the drill bit follows the normal trajectory of the locking hole. The screw is inserted using standard technique. In certain shaft fractures, a cortex screw can be used to stabilize or compress the fragments. Choose a hole in the aiming arm and make an incision through it. Insert the trocar with handle and guide sleeve until it snaps into the aiming arm. Make sure the arrow on the guide sleeve is in the direction of the cortex screw arrow on the aiming arm. Remove the trocar by depressing the release mechanism and pulling it away from the guide sleeve. Insert the 3.2 mm drill sleeve for neutral position into the guide sleeve, while aligning the self-retaining features until it snaps into place. Use the 3.2 mm drill bit and determine screw length from the drill bit calibration aligned with the top of the drill guide. As an alternative, place the direct measuring device over the drill bit and against the end of the drill sleeve. Determine screw length from the end of the drill bit. Remove the drill bit and drill sleeve. Insert the 4.5 mm cortex screw, initially with a power tool and then by hand. Remove the guide sleeve. Mark the location of each screw inserted in the aiming arm using a stopper for reference as screw insertion proceeds. Repeat this process to insert as many cortex screws as are necessary into the plate shaft. The instruments needed to insert variable angle locking screws off-axis in the plate shaft are the protection sleeve, the 4.3mm variable angle drill guide, the trocar, the 2.5mm guide wire with drill tip, the 4.3mm calibrated drill bit, the T25 star-drive screwdriver shaft, and the T-handle with torque limiting function 6 Nm. Variable angle locking screws inserted off-axis allows a greater degree of angulation in periprosthetic situations to avoid any existing implants. Choose a hole in the aiming arm and make an incision through it. Insert the drill guide into the protection sleeve and screw into place. Insert the trocar into the drill guide. Insert the assembly through the incision and into the plate hole. The spherical tip of the variable angle drill guide should be gently pressed into the variable angle hole to ensure the lip of the drill guide stops on the edge of the hole to prevent drilling beyond 15 degrees. Depending on the desired angle, the assembly can be placed through the aiming arm hole or it can be placed outside of the aiming arm. Remove the trocar. Insert a 2.5mm guide wire through one of the wire holes around the central hole of the protection sleeve and into the bone. The assembly is now provisionally fixed at the desired angle. Depending on the guide wire location, the wire may need to be cut to allow room for drilling. Insert the 4.3mm drill bit through the variable angle drill guide and drill to the desired depth. The positioning of the drill must be controlled under image intensification. Determine screw length from the drill bit calibration at the top of the drill guide. Remove the drill bit and the drill guide. Insert the appropriate 5.0mm variable angle locking screw through the protection sleeve. Control the position of the screw under image intensification before final tightening. Final tightening must be done by hand using the T25 star-drive screwdriver shaft and the T-handle with torque limiting function 6 Nm. Remove the guide wire and the protection sleeve. Mark the screw location in the aiming arm using a stopper. The instruments needed to insert variable angle locking screws through the aiming arm are the guide sleeve, the trocar with handle, the 4.3mm drill guide, the handle, the 4.3mm calibrated drill bit, the T25 star-drive screwdriver shaft, and the T-handle with torque limiting function 6 Nm. Remove the guide wire and wire guide. Insert the 4.3mm drill guide through the guide sleeve and thread it into the plate hole using the handle. Remove the handle. Prepare the screw hole with the 4.3mm drill bit. Read the screw length off the calibrations on the drill bit. Remove the drill guide. Insert the corresponding length variable angle locking screw. Final tightening must be done by hand using the T25 star drive screwdriver shaft and the T-handle with torque limiting function 6 Nm. Remove the guide sleeve by depressing the release mechanism. Mark the screw location in the aiming arm using a stopper. To replace the pull reduction device with a variable angle locking screw, first loosen the nut on the device with the combination wrench and then by hand. Remove the device with the power tool. Prepare the screw hole with the 4.3 mm drill bit. Read the screw length of the calibrations on the drill bit. Release the drill guide with the handle and remove it. Insert the corresponding length variable angle locking screw. Final tightening must be done by hand using the T25 star drive screwdriver shaft and the T-handle with torque limiting function 6 Nm. Remove the guide sleeve by depressing the release mechanism. Mark the screw location in the aiming arm using a stopper. Loosen the connecting nut of the aiming arm with the combination wrench and remove the aiming arm from the insertion handle. Loosen the locking bolt with the combination wrench and remove the locking bolt and the insertion handle. It can be seen that the plate is correctly placed on the condyle and that the plate bridges the multi-fragmentary metaphyseal region. This presentation has shown the clinical indications, an introduction to the principles of the variable angle LCP curved condylar plate system 4.5 5.0, the patient position and approach, and the reduction and fixation of the fracture.